today we are here to talk about hair restoration, surgeries, and especially FUE technique. But before, I would like to introduce you Dr. Kayihan Sahinoglu and Dr. O.Tayfun Oguzoglu for opening and welcoming speech.
Welcome to the ISHRS FUE CADAVER&LIVE Surgery Istanbul workshop. We hope you all have a wonderful learning and training experience in these 2 days.
I would like to speak Turkish because I want to explain all of you why we organize this kind of the workshop. FUE uygulamalarının dünyada yüksek talep görmesi ancak bu talebi karşılayacak yeterli sayıda FUE doktoru olmaması, bu nedenle de black market olarak adlandırılan teknisyen cerrahisi veya çeşitli robot sistemleri üzerinden teknisyenlerin FUE yaptığı kliniklerin her geçen gün çoğalması, FUE'nin öncüleri olarak bizi böyle bir eğitim programı hazırlamaya yöneltti.
I would like to talk about anatomy and first embryology. I know this is the most boring subject, but I will try to make it simple.
I decided to start by trying to define what hair transplantation or hair restoration surgery is.
I actually have no disclosures, just have conflicts of interest with those who create ugly hairlines. The hairline is actually the largest horizontal. The same is about women. They seem to have similar hairlines, but they don't. Horizontal.
I would like to talk about all the instruments that we can use for do FUE.
So what constitutes donor capacity? I mean, you saw some patients up here that we looked at the back of the scalp, and some were good, and some from the back didn't look so great.
Constantly, if you see the picture on the left, you can see how the natural hair spreads. Unfortunately, we shouldn't do that because you will not cover the patient adequately if you do it exactly as it is in nature.
During deposition, the artist is reading the little part black.
Okay, so my topic is FUT versus FUE, the most violent topic of all.
The evidence-based European guideline for diagnostic evaluation and treatment of androgenic alopecia recently became available.
Whenever I mention Dr. U graft or Dr. U punch, I have a conflict of interest there because I have patents and commercial interest in those technologies.
Postoperative care, that's the topic I have today. So this is extremely important. You can do a fine surgery, but if you don't take care of the patients afterwards, you may compromise the results.
Regenerative therapies, one is PRP, everybody knows the PRP and talk about more. CRP, Regenera, and the cloning of the follicles.
So probably everybody of you knows about the ISHRS, which is a non-profit medical association with more than 1,000 members throughout approximately 80 countries at the moment.